So good afternoon, everyone. Bonjour tout le monde. Today, we'll start off our remarks with Dr. Tam, followed by Dr. New, and then, of course, my colleague, Minister Miller, will provide an update as well, and I will also give an update on Made in Canada. So over to you, Dr. Tam.
Bonjour à toutes et à tous. Today, I want to talk about the latest age trends in our surveillance data, but first, I'll start with the usual update on numbers. There have been 125,647 cases of COVID-19 in Canada, including 9,083 deaths. 89% of people have now recovered. Labs across Canada have now tested over 5 million people for COVID-19 to date, but the weekly average number of people tested daily is the most important number to follow now, as it tells us we are maintaining testing at a high level, with an average of almost 48,000 people tested daily and about 0.7% testing positive. We are testing more than 140 people for every positive case. Over the past 14 days, an average of 400 new cases were reported daily from across the country. As we continue our collective effort to limit the spread of COVID-19, we are closely monitoring disease activity indicators in order to inform, adjust, and adapt our actions as needed. Nationally, average daily case counts have remained relatively stable in recent weeks as we keep a watchful eye on the trend of the epidemic and look out for warning signs of increasing severity and impact on high-risk populations. Regionally, we are seeing increases in daily case counts west of Ontario, reminding us that the virus can emerge anywhere and we can't afford to let our guard down. Compared to the first peak of the epidemic in Canada, young people account for the majority of cases over many weeks. Of the new cases reported last week, those under 40 years of age accounted for almost half, or 46% of all cases. Among these, 20 to 29-year-olds were overrepresented, accounting for 25% of cases, but only 14% of the Canadian population. Cases in the 30 to 39-year-olds followed, accounting for 21% of new cases last week. Despite daily case counts remaining at or under 500 cases daily since mid-June, down from the high of almost 1,800 in early May, there is still cause for some unease. Most young people will experience milder illness with COVID-19, but not all. Some have experienced prolonged symptoms or developed serious illness requiring hospitalization, and others have passed on the illness to other family members and contacts. The most concerning issue is that as COVID-19 continues to circulate in any age group, as it has 4 weeks in young adults, it builds a reservoir of the virus that can spill over, affecting others, young and old. That includes older adults at high risk of severe COVID-19 outcomes and people of all ages with underlying medical conditions. I'll be honest, reaching young adults with a message that will resonate and spur action is a challenge. This stage of life is such an important time to establish and nurture social networks, careers, and life partners. Every age group will have their own way to adapt and cope, and I have no doubt that young adults have ideas, creativity, and innovation that can make this work for them. In the prevention paradox, no one can say for sure how many cases and deaths will be spared by our missed parties or pledge to always physically distance, wash your hands, and wear a mask. But one thing is easy to know, that all our actions do matter, and being part of the solution to this pandemic is the right action to take. So help us make it happen. Thank you.
Bonjour.
Aujourd'hui, je vais vous parler des dernières tendances selon l'âge dans nos données de surveillance. Et je commencerai par les chiffres habituels. Il y a eu 125 647 cas de COVID-19 au Canada, dont 9 083 décès. Des personnes infectées, 89% sont rétablis. À ce jour, des laboratoires de partout au pays ont analysé les tests de dépistage de la COVID-19 de plus de 5 millions de personnes. Cependant, le nombre de personnes que nous testons en moyenne chaque jour est le chiffre le plus important maintenant, parce qu'il nous indique que nous maintenons un nombre élevé de tests de dépistage. Avec une moyenne de presque 48 000 personnes testées par jour et environ 0,7% des résultats positifs, nous testons plus de 140 personnes pour chaque cas positif. Au cours des 14 derniers jours, en moyenne, 400 nouveaux cas ont été signalés chaque jour partout au pays. Alors que nous poursuivons nos efforts collectifs pour limiter la propagation de la COVID-19, nous surveillons de près les indicateurs d'activité de la maladie afin de guider et d'adapter nos actions aux besoins. À l'échelle nationale, le nombre moyen de cas quotidiens est resté raisonnablement stable au cours des dernières semaines pendant que nous surveillons de près la tendance de l'épidémie et sont à l'afflux des signes de gravité croissants et à l'incidence sur les populations à risque élevé. À l'échelle régionale, nous observons une hausse du nombre de cas quotidiens à l'ouest de l'Ontario, ce qui nous rappelle que le virus peut survenir de n'importe où et qu'il est essentiel de rester vigilant. Comparativement au premier pic de l'épidémie au Canada, les jeunes adultes représentent la majorité des cas depuis de nombreuses semaines. Presque la moitié des nouveaux cas, soit 46%, signalés la semaine dernière, étaient des personnes de moins de 40 ans. Les 20 à 29 ans y étaient surreprésentés, c'est ces 25% des cas, mais seulement 14% de la population canadienne. Suivez les cas dans la tranche de 30 à 39 ans, qui représentaient 21% des nouveaux cas la semaine dernière. Même si le nombre de cas quotidiens demeure sous la barre de 500 depuis la mi-juin, en baisse par rapport au sommet de près de 1800 atteint au début de mai, il y a tout de même lieu de s'inquiéter. La plupart des jeunes adultes présenteront des symptômes faibles s'ils contractent la COVID-19, mais ce n'est pas le cas de tous. Certains ont présenté des symptômes prolongés ou développé une maladie grave nécessitant l'hospitalisation et d'autres ont transmis la maladie à des membres de leur famille et à des contacts. Ce qui est le plus inquiétant, puisque la COVID-19 continue de se propager dans tous les groupes d'âge, comme c'est le cas chez les jeunes adultes depuis des semaines, cela crée un réservoir de virus qui peut se transmettre touchant les autres jeunes et vieux. Cela comprend des adultes plus âgés susceptibles d'être gravement malades s'ils contractent la COVID-19 et des personnes de tous âges ayant des problèmes médicaux sous-jacents. Pour être honnête, ce n'est pas facile d'envoyer un message qui trouvera écho auprès des jeunes adultes et qui les incitera à l'action. Cette étape de la vie est cruciale pour établir et entretenir des réseaux sociaux, commencer et faire évoluer une carrière et créer des liens avec un partenaire de vie. Chaque groupe d'âge s'adaptera et composera avec la situation à sa manière et je n'ai aucun doute que les jeunes adultes sauront se y faire grâce à leur créativité et à leurs idées novatrices. Dans le paradoxe de la prévention, personne ne sait avec certitude combien de cas de décès auront été épargnés par notre décision de ne pas aller à une fête ou par notre engagement à toujours garder une distance physique avec les gens, à se laver les mains et à porter un masque. Mais une chose est sûre, c'est toutes nos actions comptent et que faire partie de la solution à cette pandémie est la chose à faire. Aidez-nous à y arriver. Merci.
Thank you very much, Dr. New and Dr. Tam, and over to my colleague, Minister Miller.
Thank you, Navdeep. Kwe, Tanse, Onusakut, good afternoon, bonjour. This week again, we continue to see progress in flattening of the COVID-19 curve in Indigenous communities across Canada. To date, as of yesterday, there have been 437 positive cases on reserve, 411 of which have recovered. This is encouraging and demonstrates that many communities have been successful in their efforts to stop the spread of the virus, thanks to the leadership they have shown and the actions they've taken. This has saved lives, yet we must remain vigilant. We must continue to take all necessary measures to protect individuals, families, and communities, and must be prepared for a second wave of this dangerous virus. We must put health and safety first, and not just physical health, but mental health. Recent studies done by Statistics Canada have highlighted greater mental health impacts in Indigenous peoples compared to non-Indigenous Canadians, and even more so in the context of COVID-19. Les répercussions intergénérationnelles de l'héritage colonial du Canada, les inégalités dans le financement des services de base et la discrimination continuent et contribuent aux challenges auxquels les peuples autochtones sont confrontés chaque jour, qui sont accrus par les problèmes de santé, non seulement pour les individus, mais pour les communautés dans leur ensemble. Nous reconnaissons qu'il existe une disparité entre les services en santé mentale offerts aux Autochtones et aux non-Autochtones du Canada. Et nous savons que cette situation est entièrement inacceptable. Unfortunately, the COVID-19 pandemic has only exacerbated the situation. Prior to the pandemic, demand for counseling and mental wellness support was already trending upward. From January to April 2019, the Hope for Wellness Helpline received 3,602 calls and chats from individuals seeking crisis intervention services. For this same period in 2020, there were over 10,000 calls and chats. Sustained targeted investment is needed to ensure that culturally safe mental wellness services remain available, and community-driven, culturally appropriate, and timely mental health supports are critical to the well-being for anyone struggling to cope with the added stress and anxiety that the COVID-19 pandemic has created. It's essential that First Nations, Inuit, and Métis have access to mental wellness services they need. The full impact of COVID-19 on the mental health and wellness of Indigenous peoples and communities will likely not be fully appreciated until long after we emerge from this pandemic. We see the stress being felt within and across communities, and you know that stressful situations may trigger past trauma. The needs that must be met are continuing to grow. And that's why today, the Government of Canada is announcing $82.5 million to be spent this year on urgent mental wellness supports in Indigenous communities in response to the added burden of COVID-19. This funding will support access to additional services and the adaptation of existing mental wellness services to the COVID-19 context, including support for culturally safe services on the land and in communities, transitioning some existing services to virtual platforms, and supporting Indigenous partners in the development of innovative strategies to address substance abuse and harm reduction. Des investissements soutenus et ciblés et des services culturellement appropriés sont essentiels au bien-être de toute personne qui lutte pour faire face au stress et à l'anxiété supplémentaire que la pandémie de la COVID-19 a créé. Les besoins à satisfaire ne cessent de croître et c'est pourquoi aujourd'hui le gouvernement du Canada annonce que 82,5 millions de dollars seront consacrés cette année à des mesures urgentes de soutien en santé mentale dans les communautés autochtones en réponse à la COVID-19. Ce financement permettra entre autres de soutenir l'accès à des services supplémentaires et adapter les services existants dans le contexte de la COVID-19, notamment en fournissant des services culturellement appropriés dans les communautés, en faisant la transition de certains services vers des plateformes virtuelles et en soutenant les partenaires autochtones dans l'élaboration de stratégies innovantes en santé mentale. We will continue to work with First Nations, Inuit, and Métis partners and communities, as well as provincial and territorial governments, to safely adapt and expand current mental wellness services and support in the context of COVID-19. And while the COVID-19 virus has affected nearly every facet of day-to-day life, Indigenous Services Canada will continue to support the delivery of quality care while Indigenous individuals and communities take the lead in responding to their unique, evolving needs. This partnership with Indigenous communities has been the cornerstone of our approach and efforts to date. We're listening and tailoring our supports to Indigenous individuals, businesses, and communities based on their feedback. A remarkable example of leadership is the initiative put forth by Anishinaabe Nation and Mental Health and Addictions Pandemic Response Program. With our support, they've been able to put in place a unique First Nations-led initiative to respond to the specific health needs of community members in Northern Ontario. It will identify the mental health and wellness services they are already available and will work to bridge the existing gaps so that every individual can have access to culturally safe and community-based mental health services when needed. In the spirit of partnership, the program will be run by KOE Health and Sioux Lookout First Nations Health Authority, and the services will be coordinated, delivered, and promoted by regional health authorities, tribal councils, and community organizations within the NAN region, and will offer access to high-quality and culturally safe substance use treatment and mental health services. I'm happy to highlight the great work they've done for First Nations living in Northern Ontario. Une fois de plus, nous reconnaissons que les peuples autochtones, en particulier les jeunes pris en charge, sont parmi les plus vulnérables et font face à des défis uniques pendant cette pandémie. C'est pourquoi nous prolongeons les mesures qui garantissent que les jeunes des Premières Nations, qui en temps normal ne seraient plus pris en charge par les services de protection de jeunes en raison de leur âge, continueront de recevoir le soutien dont ils ont besoin, et ce jusqu'en mars 2021. And with September right around the corner, Indigenous Services Canada also continues to work with partners to address the challenges related to the reopening of schools and the increased pressures they're facing. We're supporting educational and other supports to implement best practices in accordance with public health guidance around PPE for children, for example, through the procurement of public health measures such as non-medical face masks, acrylic sheets or plexiglass retrofits, and hand sanitizing stations for schools and First Nations communities. ISC will also support First Nations and their partners in their decision-making process regarding school reopening for on-reserve establishments. The Government of Canada's first priority remains the health and safety of all, including First Nations, Inuit, and Métis. Miigwech, Marcy Cho, Nakumik, thank you, merci à tous.
Thank you very much, Mark. And good afternoon, ladies and gentlemen. Today I want to share an update on contracts we've signed with Canadian companies as part of our Made in Canada efforts to fight COVID-19. In early April, the Next Generation Manufacturing Supercluster announced an agreement with a consortium led by Molded Precision Components with partner Sterling Medical to produce face shields. Today, Molded Precision Components is now producing more than 3 million shields a week. This has allowed them to maintain all existing positions and add 166 new jobs. They're also now in the process of opening a second manufacturing facility in Ontario. Of course, in true Canadian fashion, the group has also donated shields to community organizations such as the Barrie Fire Department and the local healthcare facilities. So moving now to this week's new agreements. Through the Innovative Solutions Canada program, we have signed a contract with Innova Tools to develop a hand-washable, reusable face shield. With these face shields, RCMP members will be able to perform tasks in close proximity with social distancing cannot be respected. These face shields will allow the public to see RCMP members' faces when interacting with them. After testing, Innova Tools estimates these innovative shields will be market ready in about 6 months. Also under the Innovative Solutions Canada program, we've signed 3 more contracts. First, Fusion Genomics has developed a technology capable of detecting all viruses, such as COVID-19, that affect humans and that also appear to be carried by animals. The firm will work with the Canadian Food Inspection Agency to survey a number of target species for COVID-19 and other viruses considered to be a threat to human health. Next, Global Spatial Technology Solutions is using an AI-based system to process satellite and maritime data sets to assist decision makers within the Department of National Defense in real time. This will help health, safety, and security agencies navigate public health emergencies such as the COVID-19 pandemic and other safety and security-related events. Il y a un mode qui a recours à l'intelligence artificielle pour trier un grand nombre de demandes en ligne afin d'aider les hôpitaux et les organismes du gouvernement dans le traitement de l'information pendant les crises. Obviously, this is a much-needed solution as we continue to battle COVID-19. The NRC, the National Research Council, is leading on 2 other Innovative Solutions Canada challenges which have recently been awarded. We've identified the Phase 2 winners for the N95 Respirator Challenge. Steadfast and Roswell Downhole Technologies will develop materials to protect healthcare personnel against exposure to airborne particles and droplet hazards related to the COVID-19 pandemic. We're also announcing the Phase 1 winners for the Low-Cost Sensor Challenge. Braebon Medical Corporation and Cloud Diagnostics Canada, ULC, will receive funding to develop a system that can be manufactured for less than $25 and can continuously measure patient temperature, oxygen saturation, blood pressure, pulse, and respiration rates. Ces données seront transmises sans fil à une poste de surveillance des patients touchés par la COVID-19, y compris ceux qui se trouvent dans les salles d'urgence, les services de soins généraux, les communautés et les centres d'hébergement. Je remercie sincèrement le CNRC pour la gestion de ce deux défis. Our COVID-19 testing capacity received another boost this week with 2 new contracts signed to produce and supply guanidine, a chemical that is necessary to perform COVID-19 testing. Big thanks to BioBasics and Rain Pharmaceuticals for helping put into place a strong capacity to produce this high-demand, short-supply chemical. I'm also pleased to announce that we now have a contract in place with Precision ADM to use its 3D printing expertise to make testing swabs. These will be among the first nasal swabs to be produced by a Canadian company. Precision ADM est actuellement en mesure de produire 120 000 échantillons par semaine et contribue ainsi à répondre à la demande très élevée à l'échelle nationale. Moving now to 2 new projects based in the Maritimes that we are supporting under the Next Generation Supercluster. The first is Luminultra Technologies, which has already developed diagnostic and environmental testing solutions for COVID-19. À la suite de son expansion, Luminultra sera capable de livrer 500 000 poussées par semaine. Cela aidera les Canadiens à retourner travailler dans des conditions presque normales. The second is DMF Medical. The company is receiving support to modify anesthesia machines to act as much-needed ventilators. This will increase the capacity of critical care units to make sure that we can address the needs of COVID-19 patients. And on the research side, we have funded the CAN COVID Network, founded in March 2020 in collaboration with our Chief Science Advisor, Dr. Mona Niemer. The network includes more than 2,300 Canadian COVID-19 researchers, clinical collaborations, and healthcare stakeholders. And with the support of a secretariat housed at the Dalla Lana School of Public Health at the University of Toronto, the network will help strengthen COVID-19 science and research and further our understanding of the virus. As you can see, we're achieving impressive results as part of the Made in Canada response to COVID-19. Although we may have some distance left to go, we're forging a path forward to make sure that we get the desired outcomes together. Thank you very much. Merci beaucoup. And now we'll take some questions.
Thank you, Minister. Merci, Monsieur Ministre. We'll now start with questions from the phone. One question, one follow-up. Nous allons maintenant prendre les questions au téléphone. Une question de suivi. Opérateur.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez, s'il vous plaît, appuyer sur étoile 1 maintenant pour poser une question. And the first question, la première question est de Lee Bertium from the Canadian Press. Please go ahead. Your line is open.
Yes, thank you. This first question is for Minister Miller. First Nations chiefs are saying Ottawa is ignoring urgent requests for supplies and dedicated funding to protect First Nations schools against COVID-19. Some schools in Northern Ontario are even looking at pushing back the reopening because of the lack of supplies and support. Why is the federal government not offering more dedicated COVID-19 money to First Nation schools to ensure students and teachers are protected?
Thank you for the question, Lee. And I perhaps haven't been as clear on this issue as I should have been. And it is out of concern for the jurisdictional web that we faced as a federal government in ensuring that everyone stays safe and no one is left behind. But let me be clear. I have said, and I spoke as recently as this past Friday to Grand Chief Alvin Fiddler on that specific issue as to the reopening of schools, is we will be there for First Nations schools as they reopen and as they face the challenge that all of us are facing and the uncertainty. and what is essentially risk management in opening up schools for their children. And I have said, and I will say in no uncertain terms, that we will be there to help, whether it's issues with respect to hand sanitizers, retrofitting, ensuring that everyone has all the proper guidelines. And I'll stress to say that the provincial guidelines that have been circulated are a minimum. And we will be there to assist them in the needs that they have. And if there are any requests for funding, they should be directed to our regional directors. And I have said those, and I said that expressly to Alvin Fiddler on Friday in respect to your specific question, Lee. But this is an issue that that affects everyone, all Indigenous peoples in Canada, as they face the very difficult choice of how they best serve their children as they go back to school on reserve, as well as communities that live closer to urban centres and are sending their children off reserve. We need to have policy flexibilities within our department to address those issues, because as we know, in the more urban areas is where we have seen the larger spikes of COVID, and children that are going off reserve to study in those areas are particularly vulnerable, and we're conscious of that as well, and we'll be there to help. And I'm hopeful that we will. I'm hopeful, and I know that we have the financial resources dedicated to that specific need, which is of pressing concern for the month of September. Thank you, Lee.
Thank you. And a question for Dr. Tam. There's a new Statistics Canada survey or poll that's come out just today talking about the COVID-19 vaccine. Suggests there's still about 15% of Canadians who would not get a vaccine. Among the reasons that are given is that they don't have confidence in the safety of the vaccine. There's concern about risks and side effects. And I was hoping you might be able to address some of those concerns.
Well, I think every concern is a valid concern, and we do need to address them in more detail, especially as we are working very hard in the provision of a safe and effective vaccine or vaccines for Canadians. So we will be doing quite a bit more work with there's a lot of expertise in Canada in terms of working together to address the complex issue of vaccine confidence. So it is something that is very much an integral part, I think, as our vaccine program implementation planning going forwards. I think that it's important to recognize that we do need more information on who this group is. It may be a heterogeneous group, or it could be very specific populations in Canada, which needs specific engagement on this front. I'm also, of course, concerned about the first pandemic in the age of the internet and social media. So this is an area of significant work, because we have an overload of information through which many Canadians can't sort of sort out what is credible and what is not. So we're trying to work on that front. But I do think social media and internet companies do have responsibilities in terms of their role in this space. So I look towards different partners, different government departments, also coming together to look at how we better address some of the mis and disinformation that is in that space. That is, I think, fundamentally a massive challenge. The other aspects of vaccine confidence is, I have said before that we are looking towards safe and effective vaccines, and Health Canada, our regulator, continues on that front. And just because there's an accelerated process to get vaccines for Canadians does not mean we're going to shortchange anything on safety and effectiveness. And we'll be, providing that information as vaccine clinical trials results come in as well. So, and I do have confidence in our regulatory system. And so part of that is, so there's many different components, I think, to address the varied landscape of vaccine confidence.
Thank you. Next question.
Thank you. La prochaine question, the next question is from Sébastien Desrosiers de Radio-Canada. Please go ahead. La parole est à vous.
Oui, bonjour. Ma question est pour...
My question.
Ma question est pour la Dr Tam ou le Dr Mou. Le gouvernement du Québec annonce aujourd'hui qu'il ne demandera pas aux Québécois de télécharger l'application Alerte COVID. Sachant qu'elle a été mise au point par Santé Canada, sachant aussi que son succès dépend de son adoption dans la population, qu'est-ce que vous pensez de cette décision de Québec?
Merci pour la question. C'est Dr. New. Nous continuons à travailler étroitement avec nos homologues des provinces et territoires. C'est sûr que nous autres, dans le domaine de santé publique, on est tous sur la même page aussi avec nos homologues de Québec. C'est important d'avoir aussi comme la technologie, les apps qui peuvent nous aider dans le traçage ou même au moins identifier les gens peut-être qui se sont exposés au COVID-19, mais on fait une compte, on sait aussi que c'est sûrement une aide. Il y a d'autres choses qui sont, d'après moi, plus une priorité. C'est vraiment la capacité de bien identifier, la capacité de dépister les gens qui peut-être se sont exposés. Et les apps, des choses sur le smartphone, c'est toujours un autre outil qui peut nous aider. Je pense que le Québec, les autorités continuent à évaluer, analyser c'est quoi les options et nous continuons à avoir des conversations, des discussions avec les autorités du Québec afin je pense, de trouver comme une façon de bien identifier les personnes à risque à travers le Canada. Merci.
Un suivi sur le même... Sur l'analyse, toujours. L'application, à ma connaissance, ne peut être véritablement utilisée qu'en Ontario à ce jour. Combien de personnes l'ont téléchargée et que pensez-vous de son adoption générale dans la population?
Dr. New, can you answer in French, and then Dr. Tam, are you okay to repeat both answers in English for the reporters in the room? Thank you.
Okay, peut-être je n'ai pas bien compris la question, mais la question en Ontario, oui, je pense que c'est encourageant ce qu'on voit maintenant. Je pense actuellement, à l'heure actuelle, il y a plus de 2 millions de personnes ont téléchargé l'app sur leur smartphone. Et je pense que c'est bon pour c'est seulement quelques semaines. C'est sûr que c'est important d'avoir plus de personnes, mais pas au début. Je pense que c'est pas mal et je pense que c'est, comme j'avais déjà constaté, c'est toujours un outil. C'est pas comme c'est la solution en total. C'est fait partie d'une toute une gamme des outils, des moyens qu'on doit utiliser pour vraiment identifier les personnes peut-être infectées avec la COVID-19, aussi pour bien assurer qu'ils sont isolés, traités, aussi pour faire le traçage des contacts, aussi pour les mettre en quarantaine au fur et à mesure quand c'est nécessaire. Merci.
So I think the question was about the adoption of the COVID Alert app. Of course, from the federal perspective, we want as many Canadians to be participating across Canada as possible. In the Ontario, in the province, which is where the initial launch started, I think we now have about 2.2 million downloads, which I think is not a bad result already, but I think further adoption will help. It is one layer of protection, as Dr. New has said. I think the concept being that if a case occurs, the faster you have the contacts identified. If people are alerted, they would go and contact public health, watch the symptoms, and go tested, is the idea of how this app would help. And so, and sometimes Canadians or people who reside in this country do also travel interprovincially, and sometimes, having an application that can be applied across jurisdictional borders is actually very, very helpful, but it is one layer of protection. And so I believe the province of Quebec is evaluating how they are layering on their protection in different ways. So I think obviously that question should be posed to the government of Quebec. But I also, as I said before, an uptake more generally in the population is great, but there are certain populations, including young adults who use a lot of technology, who also go to, as we've seen in the epidemiology, sometimes go to more crowded places where they don't know all their contacts. Is one population, I think, that we would love to have download this app as much as possible. Thank you.
Merci. Thank you. Prochaine question.
The next question, la prochaine question est de Sharon Kirky from the National Post. Please go ahead. Your line is open.
Oh, hi. Thanks for taking my question, Dr. Tam. Many experts in infectious disease are pushing for at-home testing for SARS-CoV-2. But Health Canada says that the benefits of home testing outweigh the risks and that applications for authorization of these devices will be rejected without compelling new evidence. Others, including the FDA, say that rapid tests would help us detect infectious people quickly and easily and, keep them out of places like schools. Why is Health Canada opposed to home testing, and what compelling new evidence to the contrary would you want before approving these tests?
Hello, it's Dr. New. Unfortunately, Dr. Tam had to leave for another commitment. So I just have some general remarks about testing in general. I think that it's certainly a fast evolving field in terms of testing. Certainly, I think we've come a long way since, I guess, the initial days when the first sort of PCR-based test came out. And it's still, in many ways, as we say, the gold standard. But certainly, there are lots of other testing technologies that are being evaluated, developed around the world, and obviously being looked at very carefully here in Canada as well. So what I would say is that for any new type of testing technology, obviously one of the most important things is to validate and see how well that specific test compares to, as what I said, is the current gold standard being the PCR test. So we want to make sure that the results we get from any new testing technology that may come to market or be approved in Canada would perform as well as the PCR-based test. Then I think that the second part of your question is that no matter what type of technology you would be using, I think certainly from a scientific and a public health perspective, it's important to look at the context in which you would want to use the test. Right now, obviously, we're recommending that across the country that anyone obviously who thinks they're at risk of having been infected, having COVID-19 based on potential exposure, feeling unwell and so on, certainly is encouraged to get the test. The new, I think, element that lots of experts are looking at around the world, as well as here in Canada, is what is the role in terms of potentially what we call testing asymptomatic people, and even the role of, let's say, screening certain populations on a regular basis. I think there's still limited evidence, and we still need to look carefully at what might be the risk and benefits. And I think maybe to get to your point about home testing and so on, is that if it's done in a sort of a haphazard way and not with specific criteria in mind, then what might happen is that you might actually create more problems, confusion than the actual benefits, because you might get maybe a higher risk of I would say of what we would call false negative results and so on. So there's lots to look at, but certainly I think in Canada, as around the world, we're continuing to examine new testing technologies, and certainly we want to bring it as soon as possible, obviously based on having it being validated and then approved by Health Canada, so that it can be a useful tool in our battle against COVID-19. Thank you.
Thanks. Do you have a follow-up?
Yeah, I do, actually, and it's sort of looking, Dr. New, at, there's lots of concern that we could see with the start of the flu season imminent, that there could be sort of this dual pandemics, of influenza and COVID-19. Others aren't really convinced. They think we might see less flu because we're doing things like masking and distancing. I'm wondering what your thoughts are on what potentially we might see as the flu season approaches, and how we're going to roll out vaccine for influenza when many doctors are practicing almost, a lot of virtual care. You can't give flu shots over Zoom, and pharmacies as well, just the logistical challenges of having people attend flu shot clinics. So can you just talk a little bit about what you anticipate we might see and how we go about rolling out vaccinations for influenza in this current environment?
Okay, thank you. Quite a few questions roll into that together. I would say that, first of all, you're right. In terms of the upcoming winter season, I wouldn't just talk about the flu season, but all I would say all of the sort of winter respiratory infections that we normally anticipate having. I think we're looking certainly at the experience, what's been happening in the southern hemisphere, and you're right. I think that the approach we're taking is that in some ways it's planned for the worst, but hope for the best. What's been happening, I think, in countries like Australia and so on in the southern hemisphere is that their flu season overall, I think, has been milder than in previous years, and I think that's in some ways a good reflection that all of the good public health measures that people are continuing to practice, the hand washing, the physical distancing as much as possible, the use of non-medical masks and so on, that help prevent or limit the transmission of COVID-19 would also work equally well for other respiratory infections, including influenza. So that certainly, I think, is encouraging. On the other hand, I think, as we've always talked about, it's always what we call a multifaceted approach, multiple layers of protection. And therefore, as I've said previously, certainly we would encourage people once the flu vaccine does become available, that people should go get the flu vaccine. I know Dr. Tam and myself, we get our flu shot every year. It's just sort of a matter of habit. With respect to the rolling out of the flu vaccination, we actually recently, in I think the last week or so, actually put out guidance because we recognize it will be a different kind of rollout in terms of vaccination for the flu compared to other years. And there's a very good guidance that our experts have put together with respect to how these, let's say, flu clinics might operate, maybe with staggered patients, all sorts of obviously other measures put in place to ensure both, I think, that the safety as much as possible of both the staff and obviously of the patients and clientele coming in. So I would certainly encourage folks to take a look at the guidance we put out in terms of how best to conduct flu vaccination in the sort of in the time of COVID-19. Thank you.
Thank you, Dr. New. We'll now take questions from the room. Nous allons maintenant prendre les questions dans la salle. Once again, one question, one follow-up. Encore une fois, une question de suivi. Go ahead.
Just going to take my mask off so you can hear me. Good morning, Dr. New, or good afternoon, Dr. New and ministers. Thank you for being here. It's Noah Richardson from CTV National News. I want to ask you, Dr. New, about September. September is around the corner, and as we know, there will be more people thinking about returning to their workplaces or workplaces thinking about bringing employees back. We know schools are reopening, but there are other sectors that will be returning to work as well. So I want to ask you about safety and protocols in place around people returning to work in September. So are you worried about employees not having proper training when they come back? And will you be asking the federal government or provincial governments to implement some sort of COVID-19 training protocol as people return to work?
Thank you for the question. And you're right. I think as fall approaches, all of us are taking stock of the lessons learned, what we've gained in terms of our experience that would help us hopefully as we move forward into the fall. And I think what I would point to, first of all, I think it should be up on our website, and if not, it should be there imminently, is that we actually have released a plan or at least guidance that has been put together by the Special Advisory Committee that includes obviously all of the Chief Medical Officers of Health, Dr. Tam, myself, and others, that really looks at what kind of thinking and measures should be put in place in the time of COVID-19 so that we might anticipate, and there's different scenarios out there, potential second resurgence or wave, followed maybe by smaller ones or whatever might happen in specific jurisdictions. And there are measures being put in place. I would say that in terms of training and so on, I think all of the various sectors, private and public, have done, I think, a very good job in terms of elaborating, as you say, plans in terms of protecting both the workers and the general public. I know in the federal government, we've also developed plans that actually look at how people can work in a sort of in a safe environment moving into the fall. And I think maybe as a starting point, recognizing that physical distancing and those measures are important. We're certainly not anticipating having sort of 100% of the staff going back into, quote, as they say, an office setting. So I think with that type of starting point, there's all sorts of other measures. I won't get into details. Certainly in office spaces, looking at sort of unidirectional sort of corridors, physical barriers. There's all sorts of things being considered and put in place. And I think those principles of public health, in terms of the physical distancing, the good hand hygiene, the use of non-medical masks applies both in the sort of the business world or the office setting, as well as it would in the school setting. And we have actually put out guidance as well, as you know, in terms of what schools could or should be doing. I think in many ways we recognize it's not a zero risk environment. There will be risk going forward. We will anticipate having cases moving forward. I think that the trick is to be able to manage those cases in a way that it doesn't, as you say, become an overwhelming sort of peak that overwhelms our healthcare system. And I think key to that, as we've mentioned numerous times, is to have a system in place, both public health and the healthcare system, in terms of rapidly being able to identify, detect cases as they occur, and then do rapid, contact tracing, making sure cases and contacts are isolated, quarantined, and managed in an appropriate fashion. So I think those are the keys, and I think moving forward, I think we're well positioned. We've also learned from what's been happening in other countries around the world as they've also reopened. We've seen sometimes that there's been a bit of a resurgence, and I think we're taking our lessons as well as those countries in terms of seeing what measures maybe need to be re-implemented. And I think what all countries, including ourselves in Canada, are trying to avoid is obviously, I don't think we want to go back to, as they sort of the same kind of lockdown situation as we had in the spring.
Thank you, Dr. New. I want to take an opportunity to ask a question to Minister Baines. Just about an hour before we came here to be with you, Conservative leader Aaron O'Toole gave his first address to journalists here in Ottawa. And then right after, he released the names of some of his most senior staff in his office. And so, Minister Baines, I don't know if you had a chance to look at some of those names, but some folks from the Harper era are returning to the Hill to work with Mr. O'Toole. And so I'm wondering if you see or are afraid of a Harper-era return to science and innovation, and with the Conservatives, attempting to perhaps deny or muzzle scientists like we saw under the Harper government. And if I could also just get a reaction from you to Mr. O'Toole being named leader.
Well, thank you very much for your question. First of all, on a personal level, I want to congratulate Aaron O'Toole for his victory. I know it's not easy to run, especially in public office, with regards to a young family. I'm a father of 2 young girls as well. I know it's not easy, so I want to congratulate him on his successful leadership bid. But as you've indicated, he has a clear opportunity to demonstrate that he wants to move the country forward. And with the recent hires that you've highlighted, also the issues with Derek Sloan that my colleague Pam Damoff has highlighted, they seem to be stuck in the past, stuck in divisive politics, stuck in a view that they need to muzzle scientists, cut funding for innovation. We've seen that film before. We've had 2 campaigns on it in 2015 and 2019, where we put forward a positive, progressive message, investing in Canadians and their ideas. That's the tone and posture we plan to take going forward. And it's deeply disappointing to see that Aaron O'Toole is continuing to follow the path of divisive politics, of pitting one Canadian against another, one region against another, and as you've indicated, muzzling scientists, cutting funding for science. We as a government fundamentally believe in science and will continue to support our expert and scientists.
Thank you. Next question.
Todd Lamarand, APTN News. This question is for Minister Miller. And for the benefit of my colleagues at Nouvelle Nationale, could you answer in English and French? The question is about today's announcement, the $82.5 million for mental health. You brought up the Hope for Wellness line, and jump in calls has gone up 178%. What realistically can something like the Hope for Wellness line do once some funding trickles down to them? $82.5 million probably doesn't go very far.
Oh, look, thank you, Todd, and I appreciate the question because it's an important. It is important to break this out for people to understand what this actually does. The department, and we've noticed it through whether it's increased demands for Child First when it comes to Inuit, when it comes to First Nations children, the increased demand for supports during Jordan's Principle related to mental health. This is an acute effect of COVID-19 that we're seeing, and it's measurable. The Hope for Wellness line, and I had the opportunity to speak to a number of mental health experts across Indigenous communities, whether it's Métis, Inuit, or First Nations. And one of the presentations that I was given was specifically on the results that you cited today and that I cited today with respect to the impact on children and what that Hope for Wellness line does. Over and above the statistics, behind every call is someone that is in distress and able to reach out and talk to someone on the line. And the feedback that we got, and I believe those statistics are publicly available, as well as the qualitative aspects of them, are that this wellness line is exceedingly important and it needs to continue. It needs to get continued support. The $82.5 million today is over and above the current envelopes that we have. And the very large envelope that we have within Indigenous Services Canada to support communities. The work that NAN has done regionally is exceptional. They face enormous challenges in the north of Ontario, and they are facing them admirably. There are a lot of underlying conditions that we need to address, a lot of historical trauma that we need to address. This is financial resource to put money into the hands of those who know best how to deal with mental health within their community. This isn't this is not an easy topic to discuss, whether it's publicly or privately. We need to encourage those conversations, and we need to encourage the mental health supports that are there to help them, and we will be there. As I mentioned today, the funds over this fiscal year, now this is this current fiscal year, is $82.5 million to support culturally safe services on the land, which has been an overwhelming success throughout COVID-19, both for physical health in terms of the distancing, but for the mental health of Indigenous peoples, for those communities that have chosen that on-the-land resource that we have supported communities to exercise. Transitioning, obviously, because of the need for distancing to virtual platforms, and developing and supporting the strategies that exist within communities, but for financing, which we are providing today, have not gotten as much support as they have in the past. And so we'll stand ready for additional support, but I think this is an amount that will bolster the current amounts that are being deployed into community, and then we're working with communities to help them face what is an increasing and in fact that we haven't fully measured second pandemic with respect to mental health in communities. Je le répète en français pour tout le monde.
J'essaie de me souvenir de ce que j'ai dit. Donc, l'annonce aujourd'hui, c'est un appui supplémentaire durant cette année fiscale de 82,5 millions de dollars pour faire face à cette pandémie de santé mentale qui affecte non seulement tous les Canadiens, mais les peuples autochtones qui ont été frappés de plein fouet par une anxiété qui existe, par les facteurs socio-économiques qui sous-tendent le fait qu'ils sont défavorisés par rapport aux peuples autochtones. L'argent d'aujourd'hui sera utilisé durant cette année fiscale pour déployer les ressources nécessaires financières dans les communautés pour appuyer les pistes de solutions qui existent déjà dans les communautés. Par exemple, dans le Grand Nord de l'Ontario et l'initiative qui a été chapeautée par NAN, Nishnawbe Nation. Entre autres, le Hope for Wellness Line est un appui supplémentaire pour les jeunes qui sont dans un état de santé mentale précaire, pour faire un outreach supplémentaire à des gens qui peuvent leur parler de vive voix de leurs conditions qui existent. La rétroaction que j'ai eue de par les discussions que j'ai eues avec plusieurs acteurs communautaires intervenant en santé mentale dans les communautés Inuit, Métis et des Premières Nations en est une de l'effet positif de cette ligne téléphonique qui a eu un achalandage accru, comme Todd l'a mentionné, de plus de presque 200% suite aux effets de l'impact de la COVID-19. On parle d'une épidémie de santé mentale, mais c'est une chose qui varie de personne en personne et c'est une chose qui est immensément pénible à discuter à la fois publiquement et de façon privée. Donc, on sera là toujours pour appuyer et aujourd'hui, je le dirais très clairement, c'est un appui supplémentaire aux sommes existantes qui sont dans notre département et on reste prêt à réagir de façon accrue si on voit encore un pic dans les challenges que font face les communautés autochtones.
Do you have follow-up, Todd?
Yeah, and this can just be in English, this one. You talked about earlier about how flat the curve has become on First Nations. I believe you mentioned 437 cases now. But a surge in Manitoba has meant that a couple of northern Manitoba First Nations are thinking of completely locking down again. What do you tell other First Nations and other provinces that are experiencing a surge? I'm thinking of British Columbia. Should they be following suit? Would that be your advice?
Our advice, Todd, for everyone is to stay vigilant. And with the reopening of the economies and the disproportionate effect that could have on vulnerable communities, this is something that is an immense concern. We reacted to COVID-19, the first wave, by using essentially a policy hammer to address something that was largely unknown, and it still remains to some extent unknown. But the instruments that we are deploying are moving from this hammer approach to more of a surgical instrument in opening schools, opening up the economy, assuring that we have guidelines that will allow people to return to this new COVID normal, which will remain in effect until we have an effectively deployed vaccine that affords the protection that we need in order to stay safe. These measures are in some cases some that have existed for decades, and some that we have realized work better during the COVID-19 epidemic. We are very conscious of a second wave or additional peaks and valleys or surges within different areas, whether it's northern Manitoba or BC. Let me say that First Nations have reacted admirable with the resources that they have used and deployed to keep people safe. I don't dictate from Ottawa what a particular First Nation should or should not do. We work in partnership with them to elaborate guidelines for them to stay safe. They know how to take care of their own people better than I do, or better than Ottawa does, and we're there to help. It makes the discussions more intense. It makes the discussions more fruitful because people at the end of the day stay safe. And you see the results with respect to which we are cautiously optimistic, because we know that second waves can, in the past, with respect to prior epidemics, have hit Indigenous communities harder than first waves. And so that is something that is top of mind as we affect resources into communities across Canada. But again, I don't dictate terms upon which communities across Canada keep their people safe. I think they've demonstrated more than adequately, superbly, that with the proper resources and support and proper communication with our health experts, and Tom Wong is my chief medical officer, is one that lives through it every day in terms of ensuring that line of communication is open and that we are helping people with guidelines. We faced this, I think, in June in regards to a difficult conversation over respecting ceremonies. But if we have that dialogue, if you have that communication, and everyone is on the same page as to keeping people safe, the results bear fruit.
Thank you. Next question. Prochaine question, Lina.
Bonjour, la presse canadienne, Lina Dib. J'aimerais revenir sur l'application de traçage. Avant de partir, Dr. Tam, votre collègue, Dr. New, a dit que d'une perspective fédérale, il faudrait que le plus de monde possible la mette dans leur téléphone. Je vois vos petites affiches là, qui font la publicité exactement de ça. Donc, quel impact ça va avoir que Québec décide de ne pas utiliser cette appli?
What is the impact of Quebec deciding not to use that app?
Merci pour la question. C'est Dr. New. Je pense que, oui, on sait que le Québec a pris une décision, mais je pense que les autorités de santé publique et aussi le gouvernement de Québec continuent à faire leur propre analyse parce que c'est toujours une situation, je pense, qui évolue avec les avances de la technologie aussi, la science. Je pense que c'est pas seulement le gouvernement de Québec, c'est toutes les provinces et territoires et même aussi le gouvernement fédéral. On continue toujours à faire le mieux et je pense avec l'application qui existe maintenant actuellement, on peut dire un pilote, on peut dire un projet pilote. On commence avec l'Ontario et c'est sûr que pour tout le Canada, c'est toujours mieux si on peut avoir une application qui était utilisée à travers les pays parce qu'on sait que les Canadiens, on peut se déplacer, on prend des voyages d'une province à l'autre. Ici, on peut avoir une application qui peut être utilisée pour peut-être identifier les gens qui se sont exposés. C'est toujours mieux pour tous les Canadiens et Canadiennes. Mais je pense que c'est une situation qui continue à évoluer avec la science aussi et les avances technologiques. Je pense que ce n'est pas la fin de la conversation. On continue d'avoir les discussions aussi avec le Québec. Merci.
Et M. Miller, un des raisonnements que Québec utilise pour ne pas prendre l'appli, c'est de dire que les populations les plus vulnérables n'y auraient pas accès, donc ce ne serait pas utile. Vous êtes responsable de populations très vulnérables. De quelle manière croyez-vous que cette appli peut être utile pour les communautés autochtones ou pas du tout?
Ben, Lina, pour reprendre ce que le Dr. Nou a dit, c'est un outil parmi tant d'autres. Il y a des outils qui fonctionnent plus que d'autres. Moi, je trouve que l'appli fonctionne très bien. Je l'ai téléchargé moi-même. C'est très facile et puis ce n'est pas l'outil unique que j'utilise. J'utilise le masque, je me lave les mains. J'encourage tout le monde à continuer de le faire, surtout vis-à-vis de l'ouverture des économies. C'est clair que la rétroaction qu'on a eue au niveau de la nouvelle technologie, que ça prenait une certaine version du logiciel, etc., l'accès à l'Internet, entre autres, sont des vulnérabilités dont les communautés autochtones souffrent plus que d'autres. Je ne généraliserai pas parce qu'il y a des communautés alentours de Montréal, par exemple, au Québec, qui sont très proches de là où il y a eu l'éclosion la plus importante au Canada. Donc, je ne nierai pas l'utilité d'une telle application dans ce contexte-là, mais c'est clair que ce n'est pas la solution parfaite à tout, on l'a dit très clairement, mais avec le téléchargement de plusieurs millions de personnes qui l'ont fait, qui l'ont effectué, ça peut aider, puis ça peut aider dans le traçage et le dépistage. Et donc, ce qu'on a toujours dit, ce qu'on a toujours fait en tant que gouvernement fédéral, c'était d'avoir nos propres mesures au niveau fédéral et des recommandations, mais aussi on a souligné l'importance de travailler en partenariat avec les provinces et les territoires pour les appuyer dans leur combat contre la COVID. C'est un travail de groupe. Je ne voudrais pas sortir de cette entrevue en vous laissant croire qu'il y a un conflit. C'est toujours une question de dialogue et ce qui marche mieux pour garder les gens en santé, en l'occurrence les Québécois.
Merci. Prochaine question. Next question.
Thank you. Hi, David Thurton from CBC News. My question, I believe, is for Dr. Wong. If you could speak candidly, what are the gaps that you're seeing when it comes to mental health in First Nation, Inuit, and Métis communities? Can you speak candidly? What more needs to be done? Because, you know, as the reporter from APTN said, it's probably a drop in the bucket, this 80 million.
Thank you very much for your question. For First Nations, Métis, and Inuit, we have to understand the trauma, the historic trauma, the colonization, the intergenerational trauma. Trauma like that, you do not resolve that one single day, one single month, one single year. And so the support that we stand behind First Nation, Métis, and Inuit, is the support for long term. regardless, of whether there's COVID or whether there's no COVID. And of course, in the presence of COVID, it even increases the effect of the prior trauma. And as a result of that, one has to really listen to First Nations, Métis, and Inuit. And they've been teaching us, about the use of culture as foundation, culture as prevention, and culture as treatment. Go on the land with physical distancing during COVID. That's something that's very helpful. We need to support that. We need to support the use of local resources, such as the local community mental wellness teams, to support the communities. They are led by the community for the community to support the community. We have lines, crisis lines, helplines. They are there should First Nations, Métis, and Inuit need them. All of those are important, to consider. And I think that the most important of all is the solution does not come from Ottawa. The solution is in First Nations, Métis, and Inuit. And we are here and we need to support First Nations, Métis, and Inuit to lead, the healing and the therapy by using culture and address all of the past trauma. Thank you.
Do you have a follow-up, David?
So if I'm hearing you right, the work that needs to be done is just with Indigenous communities. Ottawa doesn't need to do any more work. But I have another question for Dr. New, and it's about reinfection. We've seen a couple of stories internationally about reinfection being an issue. What is your office noticing about reinfection in Canada, and does this have any implications for a vaccine?
Thank you for the question. You're right. I think throughout the world, and obviously, I think scientists and public health experts around the world we're working very well collaboratively. We recognize this really with the global pandemic. Everyone needs to be sharing information, their experiences for the good of everyone else. And I think the reports and the sort of the evidence coming out about people, quote, getting reinfected comes back to the issue that we've all been grappling with, and that is if people do get infected and they do develop immunity, how long does that last for? And I think what we're seeing to date is that an immunity or antibodies, if they do develop, it doesn't appear, at least from some of the evidence we've seen so far, to be a very long-lasting, or certainly not lifelong. Certainly we don't have enough experience with that. And if it does last, it might be in a matter of weeks or a few months. So that's something we're keeping a careful eye on. I think it certainly has implications in terms of what people might have been thinking about in terms of natural infection and sort of a herd immunity through that kind of sort of a natural progression of the disease. And I think it just puts maybe an added emphasis in terms of what we could or should be doing in terms of research, finding hopefully an effective vaccine, a safe, effective vaccine, as well as treatments, because it certainly appears at this point that we can't count on sort of a natural immunity and sort of long-lasting sort of a protection through infection to be the way forward in terms of having protection throughout the general population. So I think all hands on deck in terms of what we're seeing around the world, including here in Canada, and certainly the ministers can speak to that in terms of the vaccine trials of what's happening. I think I would reemphasize the point, and I think as a previous question, I think Canadians should be assured that the regimes we have in Canada in terms of our regulatory system is among the most stringent and the most respected throughout the world. So in terms of the safety and security, I think Canadians can be assured that if there is a vaccine that's developed, it'll go through all of the, appropriate steps here in Canada, so that once it finally gets regulated and approved here in Canada, Canadians can feel confident that it is a safe, effective vaccine. Of course, the issue challenge afterwards is, as they say, rolling it out and actually getting, as they say, be it needles or whatever the method might be, into making sure that Canadians have access to the vaccine. But that's another step. Thank you.
And on your final comment and question, we all need to be standing behind First Nations, Métis, and Inuit in responding to the mental wellness, mental health crisis in Canada. It is extremely important that we stand behind so that no communities are left behind. Thank you.
Thank you, Dr. Wong. This now ends the press conference. Ceci met fin à la conférence de presse. Merci.